Buenas and half a day. This joint oversight hearing of the Committee on Health and Veterans Affairs and the Committee on Finance and Government Operations is now called to order. The time is now 9:30 in the morning. It is September 25th, 2025. First, I want to thank the Guam Memorial Hospital Authority for welcoming us and hosting us here at GMH. Being here allows my colleagues and myself to see firsthand the environment where your doctors, your nurses, and your staff work every single day, providing critical care to our people. For the record, official notice of today's hearing was sent out to all senators, key stakeholders, and the media in compliance with the open government law. It was also posted on the legislature's website and the public notice portal for full transparency. All hearing materials are available on the committee shared drive, and printed copies are available upon request. A recording of this hearing will be available again on the Guam Legislature's YouTube channel so that the public can review the discussions at any time. The purpose of today's oversight is to hear directly from hospital leadership and staff about pressing issues, including vendor payments, capital improvement projects like electrical panels, HVAC, and other infrastructure, IT upgrades, medical supplies and equipment, cost containment measures, and safety protocols. Before we begin with testimony and questions, I'd like to invite the chair of the Committee on Finance and Government Operations, Senator Chris Duenas, to give any opening comments.
Sidus Masi, Madam Chair, and thank you for conducting this joint oversight hearing here at GMH. Ms. Lillian, I'm sure that you maybe didn't expect to have this sending off to handle this oversight hearing this morning, but I think it's appropriate that you get your last final words in terms of your tenure and a discussion about what we're here for today on the agenda. Madam Chair, and I see a lot of, and thank you for all of the staff and management and others that are here. I see a lot of signs out there that say support GMH. And absolutely, we're here to support GMH. I want to give you a little bit of history real quickly here. Most of you, I'm sure, are busy taking care of patients and saving lives. But in the 36th Guam legislature, when members of your staff came down and made a very compelling presentation to the Guam legislature, we immediately acted, passed or introduced a resolution recognizing all of the difficulties that you had, and immediately, weeks after, passed the first $30 million in supplemental appropriation to the Guam Memorial Hospital. We also then subsequently gave a budget to you that was historic in terms of the 36th Guam legislature compared to the funding you used to get. Going into the 37th Guam legislature, we once again increased that amount. And we not only increased that amount, but we put a supplemental appropriation in for $20 million again in fiscal year 2027, or in the 37th Guam legislature, excuse me. Now going into the 38th Guam legislature, what you're looking at when we override this veto on Monday is another historic budget. You're going to get $57 million in general fund appropriation. You have $20 million recognized in the first excess revenue of fiscal year 2026. The current revenue tracking is $74 million excess revenue in this current fiscal year, which means that $20 million to be recognized is very, very achievable. Aside from that, my committee next month will be hearing a pair of bills to appropriate up to $32 million of revenue that has been realized since going on to the bond market and having refinancing done of the BPT bonds. That will be a total of over $100 million for the Guam Memorial Hospital. I'll take you back to memory lane, as many of the people who are on the panel this morning came to our office in the pre-budget hearing for fiscal year 2026, or excuse me, yeah, it's fiscal year 2026. And the revenue that we've realized to give you, if the governor signs the bills when we pass them, will be in excess of what you actually asked for. It will realize capital improvement projects. And one of the reasons why we didn't put capital improvements projects in the budget is because that's not a standard operating procedure. The budget is for your operational issues and your fixed costs. So we now have found the resources to make sure that the revenues you need to realize for the improvements of your capital improvement projects in this hospital will be realized with additional resources on top of your annual budget. We're here today, as the agenda points out, to ensure now that there's accountability. The fact of the matter is, and I'm glad Ed Burns here, we're going to have him come up when we address the issue of the $40 million. The fact of the matter is there seems to be a disconnect and a miscommunication with the executive branch and the hospital in terms of how they perceive the operations here. We passed the $40 million weeks ago. And the bottom line is we passed it so that money can be deposited into your account. We're going to find out if that happened this morning. I have a feeling it didn't. And that's because when the governor first sent down the bill for the $40 million, she did not want the hospital administration to manage that money. She wanted for Department of Administration to manage that money. But we made an amendment to make sure that it come directly to you. So we'll find out if that happened. What we want to go through today, and the purpose of being here today, is to ensure that when the legislature passes appropriations and revenue to help this hospital, that it goes to you and it gets spent on the items and the things that it was intended for. In closing to this opening remark, I really want to say this to all of you because I've felt bad that you've had to endure being pit between tax revenues and the job that you do every day. You shouldn't have to endure that. That's our job. The bottom line is you're funded by your fees and your schedules and what you have to operate this hospital and a general fund appropriation. That general fund appropriation will come from the general fund, whether the tax rate is 5% BPT or 4% BPT. Bottom line. You are not to have to worry about that. That's our job to worry about it. Our job is to work with you to get the resources that you need to run this hospital, to get these capital improvement projects done, and to ensure your stability as we all work towards a new Guam Memorial Hospital. Thank you, Madam Chair.
Thank you, Senator Duenas. At this time, I'd also like to acknowledge the presence of my colleagues that are joining us for today's oversight hearing. We have the committee vice chair of health, Vice Speaker Tony Atta. We have Speaker Frank Bluss Jr., Majority Leader Senator Jess Lujan, Senator Sean Gumatautau, as well as Senator Therese Terlahi and Senator Vince Borja. Because we have a lot of ground to cover and must adjourn by 1 o'clock this afternoon, I ask for everyone's cooperation with the following ground rules. Each senator will be limited to 5 minutes for their questions. Please use your time wisely. Get straight to your question. This is not story time, so if you don't have a question, we will move on. There will be no PowerPoint presentations. Instead, this hearing is meant to be open and an honest dialogue with hospital leadership and staff, as well as other members that have been invited, to include the Department of Administration Director, Mr. Edward Byrne, and the Guam Power Authority. Please keep your answers clear and to the point so we can make the most of the time that we have. We ask now that GMH management team and all of you who will be answering questions, please introduce yourselves.
Good morning and buenas. My name is Lillian Posadas. I am the hospital administrator. To my right is Ms. Yuka Hachinova, who is our Chief Financial Officer. To her right is Dr. Eusebio, Ricardo Eusebio. He's our Chief Medical Officer. And then to his right is Ms. Rodalyn Gerardo. She is the Assistant Administrator of Operations. To my left is Mr. Zaudi Tagadi. He is the Associate Administrator of Operations. And to his left is Mr. Jesse Kenga, our Personnel Services Administrator. We also have other members of the executive team, but they're sitting in the back, as well as all the employees.
Thank you. We'll now call up our Sergeant at Arms to swear in the panel. We'd also like to swear in DOA and the Guam Power Authority that will be testifying or answering questions.
Please raise your right hand. Under penalty of perjury, do you all affirm that any and all information you provide today, whether it be verbally, electronically, and in writing, be the truth, the whole truth, and nothing but the truth? Madam Chair, under oath, you may proceed.
Thank you. Again, as the committee chair on finance and government operations expressed, we are here more specifically to find out the status of the $40 million that the legislature approved via a bill that the governor sent down to the legislature and called us into a special session. So there was a sense of urgency despite the fact that a state of emergency was never declared, even though it was requested by the Guam Memorial Hospital. So I'll just kick things off really quickly on just what is the status of this $40 million appropriation.
Thank you, Senator Sabrina, and thank you, Senators. I just, if I want to real quick make some opening remarks, that's okay. I'll try not to take too long. Good morning and welcome to GMH. Thank you for meeting with us in our one and only public hospital facility. We're also equally and sincerely thankful for giving us another opportunity to engage in a constructive and, like you said, fruitful and healthy dialogue with our GMHA executives, employees, and medical staff regarding our one and only public hospital, its financial status, IT system, overall operations and services, to include CIP updates, cost containment initiatives, safety protocols, and vendor payments. Secondly, thank you, Senators, for supporting the passage of Governor Lourdes Guerrero's bill for the $40 million emergency appropriations, which is now Public Law 38-59. We are here before you not only as a voice for the hospital, Guam Memorial Hospital, but as responsive and responsible advocates for the thousands of lives that depend on our hospital every single day. The decision you made in supporting the passage of the $40 million appropriations bills initiated by Governor ripples throughout every department and every patient care services we deliver here at GMH, and also at the DOC outpatient clinics in Manila and in Hagåtña, and at the skilled nursing facility. So those are the other facilities that we operate and we manage, and that's where the funding also goes. Your decisive action clearly shows your conviction and compassion to continue appropriating sufficient funding for GMH so that the underfunding cycle will hopefully no longer be the mindset, the practice, or the thought process. I think I can safely say that we all know that it's embedded in our hearts and in our minds. GMH as the public hospital is an extremely and fundamentally essential, a must-have health facility because it deals with life and death 24/7, even throughout typhoons and in times of disasters. On that note, please forgive me if I offend anyone, but from my perspective as a longtime registered nurse, I believe the legislation and the legislative leadership has the advocacy, the influence, and the power to save lives. In your roles as legislative leaders, you also serve as lifelines for GMH and the community we all live in. And as you had mentioned earlier, Senators, you support the hospital, and we appreciate that very, very much. Your continued and influential support is not just about financial numbers, healthcare data, or legislative policies. It is about people, about families, and about the very fabric of our community. GMHA is the beating heart of Guam's healthcare system, and what we need, what our patients and staff need, is your continued commitment, credible and trustworthy leadership that truly supports GMH to thrive, not just here in this aging facility, but in going forward to the building of a new hospital for the people of Guam. Senators, we thank you on behalf of every patient waiting care, every doctor and nurse struggling through dwindling and lack of basic supplies, and every family that counts on GMHA. Please continue to support GMH with its mission to provide forward-thinking, high-quality, and safe patient care. Thank you, and so we are here now to answer your questions.
Thank you, Lillian. So again, 2 weeks ago, the legislature, they passed the bill sent down from the governor to appropriate $40 million to the Guam Memorial Hospital. We did that. 5 days later, the governor signed the bill into law. It's been over a week now. And can you tell us, is it still $1.3 million that GMH has received to date?
That is correct. We received 1.3 million last week Friday at around 4 in the afternoon, and that 1.3 went to the payout of the doctor's pay. The doctor's pay was 1.7, but we were able then to get additional funding. And I'll let you guys speak a little bit more about it.
Yes, what Ms. Lillian said is correct. We got the 1.3 on Friday. I met with Mr. Byrne, Director Byrne, on Monday about the payment schedule that will come in. So what immediately is happening right now as we speak is DOA is processing the payments for the health insurance premiums, withholding taxes, and the amounts we owe for GPA So that is approximately $14.3 million. So I'm expecting that to be paid off today or tomorrow. And then on September 30th, we will receive $10 million. And right now, my accounting staff is processing all of the vendor payments that we'll use the $10 million for. So as soon as the money hits the account, we'll be able to cut the checks and release them right away. On October 15, another 7.5 million will be released to us. And then by October 30th, the remaining 6.8 million will be released as well. So we're going to also reserve the $10 million of that for the IT and the electrical panel, which we'll discuss later on, to make sure that we can fund all of the things for that. So right now we are processing the payment requests so we can pay the vendors as soon as the money hits the account.
To clarify, did you say 14.3 you're expecting today?
Not
What was that?
expecting, but DOA will be paying that on our behalf because most of that is going to health insurance premiums, withholding taxes, and almost $2 million to the Guam Power Authority.
Let me just ask you this. When we were in special session, when the bill was sent down to the legislature for this $40 million, again, it was a special session. Were you anticipating that once we passed it and was signed into law that you would get that $40 million? Not after the new fiscal year or after this fiscal year ends, but before this fiscal year ends. Were you anticipating that $40 million was going to come really quickly? Not
Quickly,
a
yes,
week,
but
2 weeks, or the next fiscal year.
I remembered Mr. Byrne testifying that it really is a cash flow thing. So depending on how much cash comes in will dictate how much we can get.
I'm sorry, just yes or no. Did you anticipate that this 40 million was going to come before the end of this fiscal year?
No, I did not.
You did not
No,
anticipate
I'm
that?
being
Lillian,
realistic.
you were shaking your head. Didn't you expect that $40 million was going to be coming before the end of this fiscal year?
That was my anticipation and my hope, but understanding the reality of the cash situation that I don't have control over, I expected to get the 40 million so we could pay the vendors that we owe.
So now that you're not going to get the $40 million until the next fiscal year, have you been receiving any phone calls or any concerns from your vendors? And what have they been saying? Because I'm sure that these vendors were also anticipating that they were going to get paid before the end of this fiscal year. As most of us that were at the legislature and acted on this legislation believed that because we were called into special session and that there was $40 million that we believe was available, that you were going to get that money so that you can settle these debts.
That is our anticipation. That was our hope because we were getting phone calls and emails. Lillian, we need to laundry will not deliver the laundry come this Saturday if we don't pay. Make a payment this Friday. And so we've been getting communication from vendors that they need to be paid, and we understand that. But I can't pay if I don't have the money in my account, in our account. It's not mine.
Can we please have the Department of Administration Director, Mr. Edward Byrne, please come to the table, please?
Good morning, Senator.
Good morning, Mr. Byrne. Senator Duenas.
Masi, Madam Chair, and thank you for allowing for us to be very direct. So let's just get to it. Mr. Byrne, the discussion now and what has been happening in terms of what we have been seeing from the legislature, and we discussed this on the floor of the legislature, is there seems to be a mistrust or a disconnection between the Guam Memorial Hospital and their administrative staff and the Department of Administration in terms of the expenditure and distribution of funds. Has that been corrected?
Senator, I hope you'll allow me to be equally direct.
Please do.
Okay, so I need to correct some of the statements that were made. The 1.3 million that we paid on Friday was an emergency request, which we got on Thursday and responded to in order that the physicians' billings could be paid, and they weren't on the AP schedule that we received. So I assume they were, I don't know where the bills came from or why they weren't anticipated, but we provided the money to GMH to pay them. The $10 million next payment is actually going to be made on 9/30, which is still the fiscal 25 financial year. And that's Tuesday. The small amounts that are remaining will all be paid off by the end of the month. I met with Ms. Echanova, as she said, on Monday, which was her first available spot after the bill was passed, and we agreed this schedule. I did inform the committee at the committee of the whole, as Ms. Echanova said, that all the cash was not going to be available at once. Please let me add that this is a very aggressive schedule for our cash for our cash payments. But I've committed to it because I feel that the needs of the hospital are paramount. Now, I spent 2 years here. I'm very well aware of what goes on, and the 2 years, part of that 2 years was before we got the bond money. So we were in kind of the same situation with having lots of bills pile up. So as far as I'm concerned, my connection with the hospital, I don't think there's a disconnect.
Mr. Byrne and Yuka, everybody that's standing behind you and that has come in here to present the signs on supporting GMH needs to hear this. They need to hear that there is a commitment when the Guam legislature passes legislation for appropriations, that there is a seamless transition of that money and a plan going forward to ensure that it gets where it needs to be and the help is there. Yuka, now I need you to go on the record that you are in sync with Department of Administration, and also to Ms. Lillian, that you are in sync with Department of Administration and you understand the schedule and you can manage the schedule of distribution.
Yes, I met with Mr. Byrne Monday, and that's what we agreed to. And to put all these invoices together, my staff need time to put it together. So they have at least 3, 4, 5 days to get all these invoices together. So I said by 9:30, we have the commitment from Mr. Byrne that the money will be in. So we need to be ready to just cut those checks, get them signed, and get the vendors paid.
Mr. Byrne, so one of the misunderstandings, and like I said, I'm sad that staff has to become fiscal experts as well, but one of the disconnects has been that one of the reasons why most of the thought process was the 40 million would be available to the hospital and to Lillian directly right away was because if the fiscal year expired, what would be the transition into the new fiscal year? And it looks like by the schedule, it's very clear that this appropriation is durable. It lasts as using fund balances from prior years and current funds. Going into next fiscal year, there will be no problem in expending the schedule.
We've committed to it.
So, Madam Chair, if I can, because this is what we're here for, I'd like my colleagues to be able to ask some questions as well. If I can have, at least after that, the opportunity to discuss the new fiscal year so that the folks that are here will understand what we've done for GMH and how we've planned to make sure that you have a great future going into fiscal year 2026. With that, Mr. Chair, Madam Chair, I think we've cleared up this communication issue, and I'd like my colleagues to be able to ask some questions.
Thank you. We will go in the order of those that arrived here first, and I believe, Speaker, you were here before everybody else.
Thank you very much, Madam Chair, and thank you very much for all being here. I guess the question that I have here is obviously there's going to be an overlap in the fiscal years. This $40 million that was appropriated, and it's very interesting how you had characterized it, Ms. Posadas, $40 million emergency appropriation. I need to be able to emphasize that in the discussions that we had 2 weeks ago, this was an emergency. This was a dire need. We're sitting here today and there was only 1.3 of the $40 million that had been expended. And there are vendors, there are patients, there are employees that are waiting not for the vendors to be paid and the supplies to be, okay, as well as the electrical panel to be fixed. the concern that I have, and I want to make sure that this does not happen, and Mr. Byrne, I need for the assurances from the administration on this, is that while we anticipate that the bulk of this money is going to be coming in the next fiscal year, okay, that while the rules and that we have contained in the FY26 budget that is going to pass on the 29th, that does not, there's no confusion or conflict between that fiscal year appropriation and this appropriation, as well as the tools in that. Can I get that assurance?
Yes, sir. Just for the record, the amount that's coming in next fiscal year is about just under 14 million. Not the bulk, but yes, there will be no confusion.
Okay, I just
in
want
my
to make
mind or in the books of account.
that way, Ms. Lillian and Ms. Echanova, is the assurance that this is not now. I just want to make sure that whatever was remaining in this $40 million carried over to the next fiscal year, that the administration doesn't subtract that from the appropriation that you're supposed to get already in the FY26 budget. Mr. Byrne?
I'm not going to do that.
Okay, I just wanted to make sure of that, okay? Thank you very much, Madam Chair.
Thank you, Mr. Speaker. Senator Sean Gumatata.
Yes, thank you, Madam Chair. And I know you asked us not to have story time, but I got to make this take a moment to say thank you. I was just here up until last Monday for 4 weeks, taking care of a family member, and I told this during our session, and I now want to tell the employees here, especially those on the third floor, thank you for taking care of my family member. She's home resting, and I believe she's watching. So I want to tell you all from my family, thank you so much for what you do here. If I can just jump in, I know you mentioned it a bit earlier, but I want to just get it for the record. This is going off of the statement from our finance chairman, but to what extent is BBMR, DOA, representatives from the governor's office, since the signing on Friday of last week, did they reach out to GMHA for a spending plan based on the priority vendor payables, facility repairs, and operation needs? I think some of it's outlined here, but to what extent did they reach out for a spending plan?
We did not reach out for a spending plan. I simply discussed, as I said, with Ms. Echanova on Monday, a reasonable release of funds which aren't going to endanger the general fund. It's up to GMH to prioritize those payments, and I'm sure they will.
Thank you. I'm going to go backwards a bit because I know that I know my colleagues are going to ask very similar questions. But let me take it back a couple of fiscal years. But can you tell me, Yuko, or even Lillian, what is the status of the $10 million in excess fiscal year 2019 income tax and BPT collections, which was required by fiscal year 2020 budget, will be deposited into the Hospital Capital Improvement Fund established by the same budget law?
That was never received.
Since the 10 million was never deposited into that fund, which rendered Public Law 37-73 moot, has GMHA sought legal guidance from the Office of the Attorney General on the question of whether this money remains a financial obligation of the executive branch unless the laws are repealed?
No, we have not.
Your counsel's here. He's looking at me with some strange look. But are you going to engage the Office of the Attorney General about this matter? There, yes or no? Somewhere coming?
Yes, according to legal, he's advising that we can.
Yes, thank you so much for that. On the specific issues involving the electrical panel, which we had talked about during the hearing, what maintenance agreement and relationship has existed, or if it's in existence, between the hospital and GPA? I know they're here, ensuring regular scheduled inspections and maintenance work to the electrical system until such time that GMHA is able to develop and sustain its own capabilities with this particular function?
Thank you for that question, Senator. I am going to go ahead and yield to Mr. Zaudi Tagadi and or Rodolin. They have been meeting regularly. In fact, they just met, I think, yesterday or yeah, and they've outlined specific details on what they will do to help us out with the electrical panels. So
Thank
I'm
you,
going to go ahead
Lillian.
and,
Thank you.
do you want to speak? Okay.
Oh, I know.
Hi, good morning, Senators. So yes, we actually met with GPA last week. We do, as we've previously discussed with you all, that we do have an existing MOA with the GPA. So we met with them last week just to kind of come to a meeting of the minds of, an understanding of what exactly does our MOA pertain, like what's in there. And so yes, it is true that GPA has been providing quarterly inspections of our main electrical panel. And there are other items in the MOA that I guess we have not exactly worked with them on in the past, that there are opportunities there. And so one of the asks that we did have was if they can please take a look at the electrical plan that was also mentioned in the Army Corps of Engineer report, which they did indicate that they were already actively looking at that, as well as the Army Corps of Engineer report. And so we did ask them for a recommendation as far as prioritizing, what, given their expertise in the electrical field, to give us some recommendations. And so which they did. So thank you, GPA, for that. That just came in recently. And so in front of you, you will see a one-page document that says Public Law 38-59 Capital Improvement Projects. And on there, you will see on the bottom half, electrical system. And so parts of what's in there is based on the recommendation that GPA did provide. But we also recognize that the $5 million for the electrical panel is not going to address us procuring the entire electrical panel. And so we just have to take a look to see, based on the priority recommendations, what we can do with the 5 million, and that's what's in front of you.
Okay, so can I ask this, because, and is GPA here, can you confirm, hi Jennifer, can you confirm that that's the case? So when did you guys transmit this list to the hospital authority? And again, good morning to you and GPA.
Hi, good morning. So actually yesterday we submitted it. So we
I'm
met.
sorry, could you please introduce yourself?
Sorry, my name is Jennifer Sablana. I'm the Assistant GM for Operations at Guam Power Authority and the Acting General Manager at this time. So we met on Friday and we worked through some of the discussions we had, identifying what we thought could be a priority short term. Based on our discussion, we understood that the funding through the $40 million transfer was limited to $5 million for CIP. So we don't have any costs on our recommendations. This was based on an assessment that was done with our team and in their team, looking at some of the conditions of their motor control centers, ATS switches, which affects the operations of the generators during emergency power requirements. And so it looks, the focus was kind of on those things that we thought were more urgent and could be done sooner. Funding-wise, we don't know that yet. We are looking at seeing if we can come up with some cost estimates. This is not our what we do, but we're going to try. I think we're going to try to work with GMH if they had any costing or pricing from their drawings and their previous bids to see whether we can mark it up or do some kind of budgetary estimates to help in identifying a budget for this kind of recommendation.
So Jennifer, are you saying so the MOU that you have between the Power Authority and GMH is a current one and it's enforceable that you guys can work with?
I don't know if there's an expiration date on that. I would need to check, but we can work through their MOU for services. Our services are kind of limited. I mean, We can do what we have with our resources. We don't, our procurement is the same with GMH. I don't see us procuring for them, but we could probably assist with providing technical assistance in developing specifications or job scope or work scope to help them procure.
Could that include also vendors that could support that type of activity?
So our vendors are limited to our type of needs. I don't know that this would apply for this type of work. So, and like I said, our vendors are usually for specific tasks. We don't, while we have some like blanket purchase order services, those are limited in funding. We have the same laws of procurement as GMH does. So, if they can procure it and we can assist in helping them develop the procurement for it, we can do that.
Yeah, I think my question why I was asking Jennifer is that, GPA has been asked to help, but your help is very, very limited. You can offer up some technical things, you can look at it, but to actually touch it and pull a wire, that might be a little more
It
challenging.
depends on what the scope is.
Yeah.
And again, we are first and foremost the power utility.
That's
so
right.
I would have to reserve what we can to address the power utility needs. And then if it's something we could do, we can try to do it. Even our inventory, if we have inventory that they could use, we can offer it up for their use.
And if I can to GMH, so if they're limited, can you possibly in this situation engage DPW to support with their electricians?
Good morning, everyone. In reference to the response, of course, we are collaborating with GPA in whatever capacity they can provide us, as well as GMH in our capacity, and other agencies, of course, that would be able to render their assistance to us. So for the 5 million, it's not limited to just GMH or GPA. Of course, we're going to get some vendors. First of all, we need our A&E, our architectural engineering consultant, to come and review again the plan. And again, all these things that we're doing will be in alignment with that plan, as well as the recommendations of GPA.
Okay, Cazaldio, I'm asking, if this is a whole of government approach. That's why we're here too. So I'm hoping that, after this discussion, that we're going to be able to engage folks like Public Works. As Jen mentioned, they can't do everything. Public Works has some capability, but I'm hoping after this discussion, Madam Chair, that we're going to see a report back that there was at least more than just GPA on this fight. Everyone in this room is expecting all of you up front to deliver administratively on this. They got jobs to do to save lives, but we're hoping that you'll do your job to support them properly in that fight to save lives at this hospital. Madam Chair, I'm all good. Jocelyn, thank you so much for, I'm good on questions. They answered most of my questions. Thank you.
Thank you.
I'd like to welcome and acknowledge the presence of my colleague, Senator Will Parkinson. Thank you, Senator. Senator Toniata.
Thank you, Madam Chair. Zaldi, on the electrical system, this has been an emergency since when?
I would say since 2019, when we came up with definitely with the usage review and inspection.
So 2019, we've known about the electrical system, and we've known about the possibility of it failing for many years now. We knew that a special session was called by the governor to address this $40 million. We knew that over 2 weeks ago. Has there been a plan from that 2 weeks, knowing and getting this prepared so that once we get the funding, it'll just go right into effect? I mean, what are we looking at in timeline to get the electrical system repaired?
Well, we started with the A&E review and recertification of the plan. We cannot proceed with a plan that is obsolete.
Absolutely. But 2 weeks ago, we went into emergency session for it. So we didn't, I was in the Army for many years, and it was the 5 Ps, right? Prior planning prevents, poor performance. So we prior planned this emergency session, and you guys weren't planning to move forward appropriately, knowing that this bill perhaps could be passed and you guys would get your funding?
Well, we were not assured of the funding coming in, so we cannot really establish procurement until the funding is assured.
But if I may clarify though, once we of course got the assurance that the senators were going to pass this bill, we did actually reach out to the engineer to request for a how much would it cost to do a recertification. We just recently got that quote.
When was that you reached out to the engineers? Because this bill
Like
was
last week,
passed.
2 weeks
That
ago?
was since we got the proposal in August 26. So that was way before the.
Okay.
See, so yes, we did. Again, we do know the urgency and we are committed. And so hence we did, because we realized that that is the first step, that we can't move forward with the plans. We have the plans, but we can't move forward until it's recertified. So that was the first thing we did ask.
So when are we looking at to putting out an RFP for this project?
So the challenge we have, sir, is that if we were going to put out the RFP based on the existing plans that we have, if again, assuming it would be recertified shortly, the RFP would then entail there's phases to the plan, and in that the original cost estimate. And I only know this because we also submitted a application for the hazard mitigation grant. And so in the application there, we're asking for about $17 million. So $5 million is not going to get us anywhere near there.
But,
But
that's not what you told us at the public hearing.
I did. If you go back,
That this $40 million will help address the electrical issues, the vendor payables, and operational needs.
yes. So for the electrical panel, what I did mention at the hearing was that it will address some of our electrical panel needs, the most immediate ones. And that's the reason why we were committing to working with GPA and trying to get a recommendation from them as far as what are the most critical needs that can be addressed based on the limited funding that we have. I do remember seeing that at the legislature that $5 million is not going to be enough, but recognizing we only have $40 million and we have other things that we need to take care of, the $5 million will at least address the most immediate needs as it relates to the electrical system.
Okay.
If I may, Vice
Sure,
Speaker,
please.
we said that of the 40 million, the bulk of that was going to be 26 million for the vendor payables, the AP, and then the remaining 14, 5 million will go to the electrical panel, 5 million will go to the IT infrastructure, 1 million will go to the HVAC, and I believe, I forgot what, the other supplies. Yes.
Thank you for bringing that up. So on the vendor payables, can you let me go down that rundown again on the 1.3 million to 14 million? What was the 14 million for?
We have approximately, let me see, 8.3 million for health insurance premiums and 4.2 million for withholding taxes. And then GPA is owed 1.8 right now.
Okay, and then you said September 30 will be the 10 million for vendor payments.
Yes.
And then following that,
We have another 7.5,
and that's for?
the electrical panel and the IT upgrades.
All right, and then you said after that was the 6.8 million?
6.8, yes.
And what's that 6.8?
So we'll use that for the remaining vendors because we do have about 13.3 million right now for the vendor payments that we're processing right now. And then the rest of it we're going to hold so we can certify funding for the IT and the electrical panel.
So the 13 million that you're saying that you got for vendor payments, is that out of this 40 million?
Yes.
Because the 10 million for vendor payments. So I was assured that the entire $26 million for vendor payables would be paid with this
Yes.
appropriation.
That includes the amounts for the withholding and the power and the health insurance premiums. So for example, for our supplies, vendors for supplies, I think was at 6 million. at that time, yeah, $6 million is just for supplies vendors. And then the service vendors was less than $1 million.
And then the $6.8 million that's remaining is going to be for operationals and other needs.
Yes, I just want to make sure that we have the cash, so when these requisitions and RFP for the two projects, for the IT and the electrical panel come down, that we can certify the funding for that because we have the money for it.
So Director Byrne, if I may ask you, would the entire $40 million from this special legislation be paid? When will the last payment be made for this $40 million?
The last payment, Vice Speaker, is the end of October.
October 30th?
October, yes. It's on the schedule.
Okay. So Zaldi, back to the electrical. So when are we going to have this process actually start taking effect so that we can get this electrical panel issue taken care of?
We could start the requisition for the A&E, review and recertification, immediately next week. And as soon as that's done and we get the plans, concurrently or simultaneously, we'll do the RFP or IFB for the main plan.
And we are looking approximately what date?
We're going to go through the procurement process. Of course, we're going to prepare the IFB documents, have that published. And,
when are we looking to have that published? I want a timeline as to what we're looking at so that we can see the progress of what's going on and how the $40 million is being spent, because that's what we're actually up here for, right? Is to know what the plans are and how we're moving forward with this emergency $40 million appropriation, so that everyone knows exactly that, you know, we've been called into special session for it, and we want to let you know that we support it, we passed it, and we want to work with you guys to implement it. So now that's why I'm asking exact timelines, so that we can come back now and say you guys are not holding to what we spoke to up here at GMH.
So if I may clarify, excuse me. So yeah, as Mr. Zaldi already indicated, the first step, of course, is we're going to put the requisition together for the recertification part. The other parts, of course, as Jennifer had already mentioned, and which is part of what we've included on our, again, that's our rough cost estimate for the, for the motor control centers, for the automatic transfer switches and the manual transfer switches to replace them with automatic transfer switches. We've included those in here. And again, we can put together our specs, but of course we're going to be working with GPA on that piece to make sure that the specifications that we're going to be putting is correct. And so that's going to take a little bit of time. I can't give you a specific timeline at the moment, but we are, again, I give you the assurance that we will be working together to ensure that this is going to be moving as quickly as we can. I'm hoping that at least by sometime next month, that we would have the specifications in place and we can at least put out the procurement, the solicitation for it.
So we're looking over a month again to get things together. My question is, if the electrical panel failed today, what is the alternative plan for that? If the electrical panel went out today, what would you do?
I think the only perceivable alternative is to evacuate the hospital.
So,
Senator, if I may just add a little bit of something. What the addressing the electrical panel today is only putting out the fire. We're not taking away the risk of the fire or anything else. We haven't addressed the whole issue. The whole issue has to be replaced, which costs a lot of money. Based on my understanding, I'm not an electrician, but a common guy, Based on my understanding, the Army Corps of Engineers already made a recommendation, but we decided we're not going to spend that amount of money because of the fact that it costs too much and we're building a new hospital. But in order to address the actual issue and the fact that there's still a risk of fire or the whole thing going to flames, is the whole thing has to be replaced, which costs a lot of money.
And that's why, Doc, we're here, so that we can address these issues, because that's why we were called into special session to address the $40 million. And again, we passed that $40 million. And, you know, to know that there's still $10 million that hasn't been paid to the hospital from the administration that you guys have not gone after. And when Senator Gumatauta was asking the question, the legal counsel said, yeah, we can. That's not the question. That's not the answer I believe the employees here want to hear. I think they want to hear, no, we're going after that $10 million. Not we can. So, you know, it's not, we're not here to try and, you know, appease anyone. What we're doing here is trying to work to the solution so that we can move forward and start getting these issues addressed. Because if they're not addressed today, someone's going to forget about depositing another 10 million or another 14 million. And then what are we going to do? Well, yeah, we can go after that later. It's just like not fighting for that $10 million in ARPA funds. So it's just a long history of money that was being left on the table that the GMH administration has not gone after and fighting for. My time's expired, Madam Chair. Thank you.
Thank you, Vice Speaker. And I think just to add to what he's saying, what we saw when we went into special session was the work of the Adelup spin doctors, sending all the employees from GMH, more than 100, trying to pressure us to do, to pass this bill that the governor sent down, and we did that work. We passed the bill, and yet we're still waiting for this $40 million to be sent to GMH. So you can understand, just as much as you are frustrated, we are frustrated, and that's why we're here advocating for GMH to get the money that you've been fighting for. Senator Jess Lujan.
Thank you, Madam Chair. Good morning, panel. Just to continue on with the Vice Speaker's line of questioning, Mr. Zaldi, he asked you basically about the panel, and this is not the first time basically that we heard about the gullibility of the electrical panel. You also had mentioned that should another fire occur, that the hospital will shut down. Knowing that your panel is very gullible, would you also say is extremely fragile, that at any point in time this can happen again to cause the hospital to shut down?
Well, we're hoping it doesn't happen.
No, not hoping. I'm saying the gullibility of the situation that we're in at this point. Yes, we hope and pray nothing's going to happen. But in your assessment on the gullibility of the panel and the fragileness of the panel, could at any point in time from now on, this panel again could erupt in fire, causing the hospital to shut down?
Yes.
Thank you. That being said, what is the most urgent fix out there besides the panel? Because this is the one thing that will close this hospital down.
Well, as in collaboration with GPA in our meeting, they pointed out various areas of priorities. So one of those, or some of those, are the main control centers, motor control centers, the automatic transfer switches, and the manual transfer switches. Those are the main ones that they recommended to be looked at. But of course, because we do have the plan, we would like to align this with the plan as well.
Well, and that's what I'm saying. It's an emergency. We got to take care of it. That's why we're here. That's why we went at the emergency session. And you had just said that mentioned that the situation is really fragile. It can happen, causing the hospital to shut down. that being the case, what is more important than this at this point? Because this is the one thing that will cause the hospital to shut down. And likewise, what is in place? What is the plan in case there's emergency that will cause the hospital to shut down? What is the plan in place for that? You must have a plan for that, because again, the gullibility of the panel, the fragileness of the panel at this point, as you admitted, it could go down at any point. What is the plan of evacuation? Because you had said that it will cause the hospital to shut down.
Can you tell us what is the beeping sound? Is it the? Is the fire alarm?
Oh, I hope I didn't cause that.
Do we need to evacuate?
I think it's clear now.
So, okay, so what is the plan should it happen? And you know, alarms going off. But what if the hospital shut down? What is the plan? What? Because you just said something like this could happen, and it's going to cause the hospital to shut down. What is the plan of evacuation?
Correct.
Immediate, today.
And that is one of the issues that I raised before, that really we have no place to evacuate the patients other than the alternate care facility that's been recognized, designated, which is SNF. That's our alternate care facility that we can then evacuate, but it's also limited.
Can we all agree then that the utmost important thing right now is to get this panel fixed?
Absolutely. We've been wanting to get it fixed, but it takes time, it takes money. And you can't just switch off this electrical panel that we have without having the new electrical panel.
That's not what I'm saying. I mean, again, we're
It's going to
reacting
take time. It's going to take time.
Senator,
Depending on the engineers, depending on the company, the vendor, if they're available or if they're even willing to.
What is the sequence for the emergency electrical repair then? Do we have a timeline on this? I mean, it's September 24th now. Okay, the emergency, it's going to take time. Okay, granted, going to take time. What is that timeline? What do we see? What do we see? This is an emergency, so what is the timeline? Is the timeline still unknown?
It is, because again, depending on the expertise of the engineers.
Are we saying a week, 2 weeks, 1 month, 2 months, 6 months? I mean, what do we foresee in that timeline? We must have some general idea on what that reaction time will be. Is it a week? Is it 2 weeks? 1 month?
To replace the whole electrical panel is going to take probably months.
Months.
Yes, months, because you can't.
So for the quick fix or the
quick fix is what we had delineated in here.
So what timeline do we see that happening? Can you give us a timeline on that?
Well, I'm approximating this to be at least 6 months.
6 months until we get that done.
That's very aggressive. Again, these are long lead items. It doesn't come off the shelf. So we need to make the order, specify it. And again, we need our A&E to confirm all this too.
So in the meantime, in 6 months, in the 6 months between now and 6 months to get it repaired, the system is still very fragile, and it could blow up again. And so within that 6 months, we could see the hospital shutting down completely, right?
Yes, that's a possibility.
Senator, the systems in the hospital always need to have backup systems, so that if something happens and there's a backup, the electrical panel switches have no backup, so that if something happens, the whole thing is shut down. It's the argument that the Army Corps engineers, as I bring up again, is the reason why you need to build another electrical panel, so that you have that backup system, so that you don't shut down.
And that's what we want to do. But in the meantime, again, we at this point, we don't have any place to go if a shutdown should happen. We're in sad shape if that were to happen. And that could very well happen, as you admit, that could very well happen between now and 6 months. So, I mean, we got to put another emergency to that emergency, cut that time down immensely. And that's why we're here. And so okay, now, so is it a money situation or a procurement situation? What is it that's going to prevent us to shorten that period of time?
It's all of those situations, sir. It starts with funding. So if we have the funding,
So we gave you
we
gave you the funding, and so that's what I'm saying. We gave you the funding, and I know there's other operational needs that will fund, but if again the hospital could shut down, if the hospital could shut down because of this situation, wouldn't that again boost it up to be maybe this is the utmost emergency that we have at this point? I don't know. I'm just saying because an emergency to you know to call an emergency and then not you won't attend to that until 6 months later. It's not quite an emergency, so maybe we need to an emergency square to be able to make it even more an emergency than just the normal emergency because it's not quite. Anyway, my time's up. Thank you very much.
So with that being said, since 2019, in collaboration with GPA, we did an MOU, and for them to come and assist us in doing the preventive maintenance that we could all do in the interim until we get a definitized approach to this issue. Nothing is being definite.
Well, I would want to put this on the backs of the GPA at this point. They haven't been awarded a contract, so.
No,
Anyway.
what we're saying is we've been working with them and they've been providing us services, and we continue that service together with them. And they come with their expertise. We do our PM as well.
Yeah, but they haven't got paid for it, so anyway.
If I may, Senator, when I started in 2019 and we went before the legislature with Senator Terlahi being the chair of health, I brought this up, that we need to do something about the electrical panel. That was in 2019. We are now in 2025 and we still haven't been able to because of funding issue. But now that I hope that there is going to be that funding, and through the grant writing, grant that we had applied for, we hope that we can get that, because the whole package costs close to 20 million. And what's in this 40 million is just not enough. But it's a start with the 5 million to then go through these items that GP has recommended for us to do in this short term. Thank you.
Thank you, Senator Lujan. Just real quickly, does GMH have a project manager for this particular electrical panel replacement? And if so, is there any sort of POEM, plan of action and milestones to set the timelines? And is there, you mentioned long lead items. That POEM, does it include the critical path to show how long it's going to take to complete the project?
So we did our initial meeting. We identified some items, and they're based on the recommendations. And again, as soon as we get the A&E requisition and PO with them, we're going to get them in and review this and see and prioritize what needs to be done.
To your question, Senator Sabrina, in terms of a project manager, we do have our FM manager, Mr. Adrian Manuel. He will then be the point of contact along with Rodalyn and Zaudi, working with GPA. Thank you.
What is the estimated timeline to receive these long lead items?
I would say as soon as the purchase order by the contractor is done, 3 months is aggressive.
3 months. Okay.
I would say 3 to 6, just considering that, our shipping challenges here on the island. And, this happens to us a lot, really, is that, for all items, not only equipment, but even for medical supplies, is that even when we think we're going to get the items, even when the vendor commits that it's going to come here in, a certain amount of time, double that, because the reality is simply that. There's times where they have issues. As a matter of fact, our 40 kVA that we're expecting, right, for our enterprise level UPS devices, it's supposed to be coming in October 1. We verified with the vendor, and they pretty much assured us it's going to be here. But unfortunately, it's going to wait another 2 weeks or so because of the typhoon, super typhoon Ragaza or something that's recently happened. And so again, these are the challenges that we do have. So yes, we'd like to say aggressively 3 months, but I'll tell you the reality is 3 to 6.
Thank you. Senator Borja?
Thank you, Madam Chair. Thank you for you guys for hosting us today. Thank you to the employees that are here. You know, I think my question is still going to be similar on what I asked at the the special session, because again, like as we sit here and continue to look at the different numbers, you know, you guys asked in asked for the FY26 budget, it was about 75.8, right? I know in the one that we just passed, it was 112. That should be coming out of the FY26 budget. And then you have the $40 million appropriation that just came, which is probably going to roll into the next fiscal year. What I'm trying to understand is, you know, what is the magic number, right? We talk about a lot of the expenses are going to be unforeseen. You have the social patients that average about $4 million. You have the reimbursement that sometimes doesn't, it doesn't equate to what it actually costs to. We also know that we can't turn patients away, so there should be an average number of how much that cost is, right? So I guess what I'm asking is that if you gave us a number today, because right now we're 150 or 112 is more than the 75 that you asked for, right? So you're going to get 115. Does that mean you guys are going to be okay for the next fiscal year? Because if you're not, then that's where I'm really confused every single time we sit and go through all these numbers, because even when we look at the CIP stuff, your vendor payables, I'm sure these are things that need to get paid. But what is the number that GMH needs, and what do you guys need? What's the number that GMH need what do you need to be able to be safe? Like, because I really, you know, based on the different numbers and the conversations and a lot of the questioning that has happened, I could foresee us, even though you're getting more than what you asked for, plus the 40 million, that we're going to be back here in 6-7 months talking about the same thing.
If we ask for what we need based on our projected operating expenses, which for FY26 was 213.6 million. So a lot goes into that. We have considerable amount that goes into staffing, dealing with the increases in the retirement rate. We have to pay for the contractual expenses. That includes our physicians that are on contract, as well as our travel nurses. There's just a lot of things, but that all goes into consideration when we put the budget together. And so it's really simply taking that amount and how much we expect to collect from our patient revenues, from insurance, self-pay, even Medicare, Medicaid, and then that difference is what we are asking from the legislature. We even consider funding from grants and such, but that's usually for like CIP projects, and we don't always get approved for those things. When we're looking for grants for hospital operational stuff, we can't find it. There's so many grant opportunities, but they seem more geared towards preventive health, like for public health, maternal child health, that kind of thing. But there's nothing really out there. We're still looking for helping public hospitals. And so that's the amount that we always ask for every year from the legislature.
But if you're asking for that amount every year, but you don't, it would be safe to say that you don't always collect what you anticipate to collect. Would that be a fair statement?
Yes, that's true.
So then if you always anticipate that you're not going to collect, then why wouldn't you ask? Because the bottom line is, when people come through the doors, we're going to have to help them, right? Which means that as taxpayers, and we understand that the government's role is to provide the service, then shouldn't that be factored into your operational costs, because it's continuous? But if you're not asking for that amount to make up for what you never get, then I guess that's why I'm scratching my head. Like, how is this, if that's the way it is annually, then really we're only going to give you what you asked for, right?
I see what you mean.
Yeah, because 75.8 is what you guys asked for. We're giving you 115. Now, me being level-minded, in 7 months, if you came and said, I need more money, I would be confused, because you asked for 75, we gave you 115. So I guess I'm trying to understand. I'm a new senator, so maybe I don't understand how you guys plan, but at least where I came from, it was like, okay, I know I'm going to be spending $200 million a year. I'm going to get $100 million in fees. I need to get $100 million to stay afloat. And if I don't get that 100 million, then I'm not asking for that, then it's my fault.
And the 133 that we expect to collect is actually a combination of what we expect from the different payer mixes. So we have the amount we expect to collect from the insurance, which is going to be a higher percentage than from what we expect to collect from Medicare or Medicaid, and then the percentage that we collect from self-pay. So the 133 is really our goal for collections. If we don't hit that goal, it's because we've run into some obstacles in collecting. For example, right now we're dealing with the insurance companies and there's a lot of denials that we're starting to deal with, and that also impacts the amount of money that comes in. But we're actively working on that. So the 133 is really the goal for the collections for the hospital, including because our gross revenues is in excess of 200 million, but we won't collect all of that. So the 133 is really the net amount that we expect to collect.
And if I may add to Yuka's response, Senator, because you did throw out some numbers of appropriations to the hospital, and a common man might reflect that if the hospital requested for 80 million and you're suggesting 112.8 was appropriated, then we surely would have met it. But when you look into what levels were appropriated, 55 million of the 112 million, we're being informed is probably not going to be made available. 35 million is an amendment made from this oversight chair. This would reappropriate funds we set aside from the 21st Century Healthcare. Adelup has said that's not going to be available. And then the 20 million is on the assumption that after you approve the $1.03 billion budget, we would still collect $20 million above that level, and that first 20 million will come to the hospital. All else equal, Senator, you're giving us 50.8 million when we need 80 million just to keep the lights on and to pay our employees. The 40 million is going to pay down accounts payable, and the difference is going to help support our CIPs. There's still an amount of CIPs needed. 29 minus the 10 we're setting aside means we're $19 million needed for CIPs, an additional $28 million needed for operations. So the hope is, if the government can collect the extra $20 million, we can reduce and offset the need for operations and make payroll, but there is a short amount, and maybe we can furnish to the committee a detailed accounting of those amounts and what that final number is.
Madam Chair, I need to just jump in here real quick because you're making some assumptions. We're cutting out the 35 million in terms of our interpretation. As you're aware, right now, $74 million is what's tracking in excess revenue in 2026 or 2025. We also now have two bills to appropriate the $32 million available in the refunding. So that's real money. It will be dependent upon if the governor signed the bill. But the fact is, that's real cash, and that's with the contemplation that I will close with after I get. But so just
Yes,
to correct your numbers in terms of what the projections from the legislature is, we have that funding source.
Yes, and thank you, Senator. I think those amounts will help shore up the difference, and we're just providing a breakdown of the amounts in the 26 budget. And I know those measures are separate and a part of the Budget Act. So we know that I think for the first time this legislative body has really delivered for the hospital. So we want to start off by saying thank you. On behalf of the hospital employees, we see that the most resources have been made available through this legislature and with support of the governor's office. So thank you for that.
Another question in regards to collections. What is your process when, like you said, you guys have a goal of collecting 120 million, right? And I'm sure you have a plan based on what your, maybe by quarter in regards to what your collections are going to be. How do you adjust when you're not meeting those collections? Because at least since I've been here, the only time we've really hear when you're not or when you're short any kind of cash is when you guys come down to the legislature. And maybe it's been communicated to the chair. But what is your plan when you say you're supposed to get 50 million every quarter, you don't get 50 million? Is that you just take it from the general fund, or is that considered an emergency, right? Like it's because it's cash that you're relying on.
Well, one of the things that's pretty obvious is we haven't been paying our health insurance premiums and the withholding taxes. So when cash is short, we have to prioritize, and so those are the two things that we have not been paying since. Health insurance premiums haven't been paid since December, and then withholding is since March. So those are the things that we don't pay, that we sacrifice so we can pay for oxygen, because they will not deliver oxygen. Our oxygen vendor is, you don't pay, we won't deliver it. And how many of our patients are oxygen dependent? It's like making those kind of decisions on who we're going to pay based on what's available.
When you say withholding taxes, you're talking about like the employees.
Yes.
Dear God.
Yes.
I have no further questions, Madam Chair. Thank you.
Thank you, Senator Borda. Senator Talai.
Thank you very much. And thank you to all of the people from the hospital who are here today to listen in on this. I'm glad that you're going to hear it directly, and that you're here to also advocate for your needs as well. And thank you to all the managers who are here. I just want to confirm, Mr. Byrne, the money that you are paying or paying out for GMH on their behalf for these payables, is that from the bond proceeds or bond savings? Any of that?
No, Senator, it's from the 40 million.
It's from what?
The 40 million.
Yes, we just said general fund.
Which is general
So where's
fund.
that from?
It's from the general fund, like the act that was enacted says.
All right, so those are just excess.
It's the accumulated surpluses that have occurred since 2016.
Okay, the surpluses, thank you. And so from the 40 million, I think what we're hearing today is that the 26 million in vendor payables are not going to be fully paid, or are they going to be fully paid? That was the estimate at the time?
Yes. Yes, that's the estimate, and we'll continue working on those payments as the cash comes in.
Are they all going to be paid?
Yes.
That's what you expect. Okay, so because we're first paying the doctors 1.3 and then 14.3 to GPA, withholding taxes and insurance premiums, and only then at September 30 are we going to get to other vendors, private vendors, 10 million, but that's not all you said. You're going to wait until the end of October for the rest of the vendors to get paid?
Yes, but our focus right now is on our suppliers, which is at 6 million, and then we have several payments ready to go for CIP, and that is around 1.5 million. So those are going to be ready to pay when the 10 million comes in. We also have some service providers that we can pay, and we also have to pay our travel nurses because we owe them $4 million.
Those are all on the 26 million
Yes,
list, right?
yes, ma'am.
So of course we have to pay all of these
Yes.
people. There's no choice.
Mhm.
And I'm asking you, who's making the choice of which ones you're going to pay first? That's pretty much you?
Yes, based on what's on our accounts payable right now
All
on
right.
our listing.
And in between paying some of these vendors, you're going to pay for IT equipment.
Yes.
Some of these vendors, I guess my question is, some of these vendors are overdue over 90 days. Yet you're saying that you're not prepared yet with the paperwork to get them paid, and that you have to wait till the end of the month to get those paid.
Because the invoices sit in the system and they're received, but once we're ready to make the payment, they have to be all gathered. If, for example, we only have $100,000 to pay a vendor, the staff will get $100,000 of the invoices and process them in the system, and then we can cut a check. So the invoices are there. They just have to be put together and then the check cut.
I know. Well, I just hope you know how that must sound to vendors who've been waiting over 90 days, that we're going to wait until the end of the month now, despite the emergency appropriation, to just
Because
get
the cash is
paperwork
not
ready.
here. So, but the staff
Well,
has been working
he's
diligently.
saying the cash is not there because the paperwork is not going to be ready until the end of the month.
No, Senator, I didn't
No.
say that.
Okay.
I
So
was-
if the cash is ready today, can we pay that today? No, right? Because the paperwork's not ready.
Right.
Right? And then, you know, I'm going to talk about this electrical panel. Lillian, you brought this to my attention in 2017. In 2017, yes, this was brought up in 2017, 2018, by previous hospital administrations to previous legislatures. Even when I was not the chair, it was brought up when I was the chair on health. All the budgets that came from for the 2020 budget, 2021, 2022, and 23, GMH came in and made their presentations and did not request for CIPs funds. They requested for operational funds. As an attachment to their budget, they made a list of CIPs. That's where I found it, the list of CIP projects. And that's why I, in 2019, included that. That's the law that Senator Sean's talking about, that was included for 10 million, despite GMH saying they didn't need it for CIPs back then. We even prioritized that it would be used for electrical panel, the EHR, and the, I think the HVAC, the roof. So all these projects, ever since back then, money appropriated from excess funds that actually became available, that we collected, so it could have been made to GMH. And every oversight hearing we've had, we follow up on that, and you always say, oh, we haven't received it, we haven't received it. And then when the ARP money was lost, we lost the ARP money. But there seems like no urgency. And but Mr. Raldi's always said, this is the weak link here, that we are susceptible to fires and we are susceptible to shutting down. There was an assessment done in 2018 by an electrical company. Then the Army Corps came in 2020, said very similar, that that was a priority. Well, their report was done in 2020. And so everybody agreed this should be a priority, except it seems GMH management. Because GMH management, if they've never, they did do an MOU kind of for maintenance, as Mr. Raldi says, but this estimate of how, tell us, the list you've given us for the 5 million, this is GPA's recommendation of just how we're going to continue to operate, but this doesn't prevent electrical fires coming up in the future as we had just in the last month, right? And then you need $100,000 to recertify the plan. And have you received your 18 million in the insurance claim that you said you were going to make for the electrical panel? And you're hopefully waiting for 17 million from the CDBG DR request, which is not going to come for 5 years, they've told us. So that's not realistic for what we need right now. But none of this 40 million then is going to go towards rebuilding this electrical, only for this immediate needs, Mr. Zaldi, that this is a recommendation from GMH as to what's the goal of this? What's it going to get us? What kind of safety?
Well, this is actually the recommendations, which is also part and parcel to the original plan that we have. In alignment with that, it needs to be looked at again with our A&E as to how this needs to be prioritized as well. So it's going to be a work among ourselves, A&E, GPA, GMH, and other agencies. So again, we need to understand the main distribution panel is, like we said, single point of failure. Why? Because we don't have redundancy. And the way this needs to be done is you need to have a new main distribution panel before you can even touch this old one. So that's the main thing that we're saying. We need to have a new main distribution panel on hand already before we even talk of removing this old panel.
Right, and that's why we've tried to do that since 2019, to give you money in order to do what the Army Corps had recommended that you do back then. And now, but what is this going to do for us as far as safety, this 5 million?
We could start with it.
No, it's going to do these things here, but yeah,
Yes.
What is the goal? Does it say this will make it safe
Well,
for the hospital?
This would address some of it, but not the main distribution panel yet.
Right, and that's the 18 million estimate.
Yes, ma'am.
Thank you, Senator Terlahi.
Thank you, Mr. Zoll. Thank you, Madam Chair.
Senator Parkinson?
Thank you, Madam Chair. In previous testimony, I know that you have said that social cases have cost GMH about 50 million over the last several years, and that has been one of the primary financial challenges for GMH because these cases often go uncompensated and contribute to your operational deficit. But this is a problem not just at GMH, but public hospitals across all of America. Have you looked at other jurisdictions that have had greater success dealing with these social cases or bed blockers? And how could we implement some of those best practices on Guam?
Thank you for that question, Senator Parkinson. I have done some literature search and I've read some articles with regards to how other hospitals in the mainland. And what I hear is that they discharge them right out the door, put them in a wheelchair, put them out. That's not what we want to do. Those are some of the things that those hospitals, county hospitals, do. They have other resources. They have transitional homes that they can transfer them to, but we don't have that. So we keep them here. There is a plan for an assisted transitional home that's been discussed, and the facility itself has been acquired, but that still, again, is in the process of getting that set up with ADA regulations or requirements that they're going to be fulfilling. But it still doesn't meet the criteria for our social cases here in the hospital to be eligible to then be transferred to that facility. So, we're looking at other options. We're going to be talking with public health, possibly using a part of the skilled nursing facility up at the Barragata Heights, and perhaps they can then administer some kind of a program for the intermediate care level of patients who do not need, medical staff or nurses to then care for them, but just caregivers. So those are what we are looking at, to address this issue with regards to the social cases. Our social services are working very diligently with families or other support systems to get these people, even in Guam housing, to get them into a housing facility, to try and get them into that area so we can discharge them. Unfortunately, it continues to build up. What we used to have as either 19 or 20 social cases, we're now up to 30 cases. So they continue to come in.
Senator, if I may add that to date, this has cost us $38 million. And I'm not sure exactly how to deal with that issue because it's costing us money every day. Certainly one of the things that the other hospital has done, which is an option to think of, is to take some of these patients who are either from the Philippines or something of that nature, and then transfer them to a hospital in the Philippines, and it'll cost us less. As a matter of fact, they're willing to pay for the airline ticket to get these patients over there because overall it'll cost us less, certainly less than $38 million. So that's certainly an option that we can do, and certainly an option that they've looked at as well.
Okay, I appreciate those answers because the bottom line is we, the taxpayers, end up paying $50 million one way or the other. So, I would like to look at what social infrastructure do we need to invest in so we could bring these costs of these social cases down and ultimately provide more appropriate living environment for these people. And to that end, should we be looking at building transitional housing or step-down facilities ourselves to move acute, longer, broader term cases out of the main hospital into a longer-term care facility? Because we're paying $50 million either way. Why don't we consider spending $50 million to build an extra facility? I also take your point about potentially moving them to other facilities that could potentially better handle the load that we, as frankly a more rural area, cannot handle. Another thing I wanted to talk about was, according to the document from June 10, 2025, the National Vital Statistic Report published by the CDC, Guam's septicemia mortality is extremely high versus the rest of the United States. More than 4 times the US average, and by far, the highest of any state or territory in the nation. We are lapping second place 4 times over. What internal infection surveillance data does GMH maintain? And what do we got to do to get these numbers down? Because for me, they are very concerning. And do you think that the physical state of the Guam Memorial Hospital contributes to the alarmingly high rate of septicemia infections that we have here? And for people of Guam, septicemia infections, I believe, are colloquially called hospital infections.
Senator, one of the major problems that we have in Guam is diabetes. Diabetes lowers your threshold and enables you to be susceptible more to septicemia. Because of our high diabetic rate, it's not surprising that we would have a higher incidence of sepsis in this island. The higher diabetic rate leads to a higher incidence of end-stage renal disease and dialysis. And you'll see the number of dialysis centers proliferate in this island. We have a significant number of patients in the hospital with end-stage renal disease and currently receiving dialysis through these catheters that they have. These are temporary catheters, and these patients are susceptible to sepsis because of that catheter being there. We have implemented a campaign where we're going to try and eliminate those catheters as soon as possible by giving them a permanent access sooner and identifying those patients as soon as possible. So that's one aspect. Preventive health is another issue that we need to focus on and need to make sure that education in regards to the susceptibility of diabetes in Guam is present. I believe public health has tried to work on that as well. I'll just say that in World War II, when the Navy came, just as sort of an educational thing, when the Navy came to evaluate the people of Guam and establish the Naval Hospital, they did a survey of how many patients in Guam have diabetes. And based on my understanding and looking at the history, the number of people that they found at that time after World War II in establishing the Naval Hospital, they found less than 10 people in Guam have diabetes. We have gone from that number to over 50, close to 50% of the patients in Guam or Chamorros in Guam have diabetes. There's a significant genetic component, there's a significant environmental, that is dietary component, and also a physical exercise component. All those three are factors in the incidence of diabetes in Guam. The reason why I'm making diabetes such a big deal is because that's why you're seeing the higher susceptibility for sepsis. Thank you.
If I may add also, Senator, really, as Dr. Eusebio mentioned, it's preventable. And so primary prevention is what we need to educate our community. Simple hand washing, basic hand washing. You'll be surprised, people don't do that. And so, if we just get people to really be grilled in their mind, anything and any time that they touch something or do something, wash your hands. And particularly in an area where there are patients who are diabetics, they're susceptible. So therefore, you as a family member, wash your hands. That's a very simple, very basic practice or even habit to have for everybody. And, that's a very preventable condition in terms of infection. So if we can just all practice that, that will help us tremendously. Thank you.
Okay, and I take your point about diabetes very well, but I just want to push back a little bit because I've been to places like the Deep South where rates of diabetes are high, and even with places like the Deep South, we are doubling their rate. And so I take the point about diabetes, but is there other factors in there that we are not considering because our rate, our age-adjusted rate is just so far beyond the mean that I feel it really requires some examination. And so I'm not going to argue back and forth with you about the science of it. I just want to put that perspective out there because it isn't, as I was doing my preparation for this meeting, it was just such an extraordinary number that it really sticks out when you see it among the national data. And then my other question was, there have been talks opinion writers like former Senator and Health Chair Dennis Rodriguez have suggested that universal health care or expanded insurance access could reduce hospitals' uncompensated care burdens and improve financial stability. What is GMH's current proportion of uninsured, uncompensated care, and how would more universal coverage affect your bottom line? How much revenue is currently lost or unpaid or unclaimed or underpaid claims?
Our uninsured population is about 15 to 18%. Those are the class of patients we call self-pay. They don't have insurance. As much as possible, we try to get them on Medicaid, and we have staff here in the hospital that actually help them with their applications and submit them to public health. And public health, we wait for them to approve it, and then they get on Medicaid. So we do have a considerable amount of people that do not have insurance and are considered self-pay, and normally they cannot pay their bills. They just don't have the means. Even if we put them on a payment plan, some of the bills that they rack up are really like hundreds of thousands of dollars. So even if they mean well and we put them on a payment plan, we can't expect them to pay more than maybe $50 a month, $10 a month, whatever. But we just want to make sure that they're on some kind of payment plan, so it looks like at least we're collecting. But then we have those that just don't even accept their bill. They won't even acknowledge they have a bill. For those, we send them to DRT for the garnishment. Some don't file taxes. These are some of the challenges that we have with our self-pay patients.
And again, how much are we losing in terms of unpaid or underpaid claims every year? Like, what does that number look like?
May I add to Ms. Yuka's comments with regards to the self-pay? We also have that population from DOC, Department of Corrections, who are inmates who end up being hospitalized and they don't have any insurance coverage or means to reimburse the hospital. And so that's why we are owed about $5 million for inpatient care of those inmates. But as soon as we just found out this year that as soon as they enter into the facility and are admitted, they're eligible for Medicaid coverage. So we have our staff get them enrolled and apply for the Medicaid. But once they're discharged, that Medicaid coverage ends. When they come back in, it gets resumed. So we found a way to at least get some reimbursement for those DOC inmates when they're hospitalized. Thank you.
Okay, but I'm still trying to figure out, though, on a year-to-year basis, what does our underpaid or unpaid claims look like as the dollar figure? Is it $30 million a year, $40 million a year?
No, it's much more than that. So our gross charges are about 230 million. We get a little less than half of that, just overall. So for Medicare and Medicaid, we only get about 30% of what we bill for Medicaid because of the structure. We're a TEFRA hospital. We get a per diem rate. For self-pay, we're probably collecting about 10 or 15% of that. For the insurance, we collect about 80%, and then the 20% is usually going to the patient share, or that could be for denials. So it depends on who is paying the bill that determines how much we're going to collect, or that percentage.
But on the whole, it's about half. You're hemorrhaging about 50 cents on the dollar.
Yes.
And
Maybe
that
less.
adds up to about 115 million a year that we're short from uninsured and unpaid claims.
Yes.
So we are basically paying $115 million a year at the most expensive rate possible.
Yes. One of the things we really want to shore up is that gap between Medicare, the Medicare rate, even the Medicare rate for physicians for the professional fee is really, really low compared to what our charges are. So, for example, A physician's fee, professional fee can be $150 for some procedure, but Medicare will only pay us maybe $15 or $20, and the rest we will not get. And that's across the nation. You know, the Medicare rate for physicians' fees is pretty low.
Thank you. I've got more questions, but I'm out of time. So thank you so much. Thank you, Madam Chair.
Thank you, Senator Parkinson. Senator Duenas.
Sidus Masi, Madam Chair, and thank you very much for your presentation. I think we've determined now, and thank you, Mr. Kenga, for recognizing this legislature and past legislatures for stepping up to the plate to help GMH. I think we can determine now that the roadmap for the 40 million has been determined. You're ready to spend it, and it will be booked in 2005. It will not affect the 2006 revenue. So we need to let all those who took their precious time to come and join us today to know now the roadmap going forward. Because now we can see that the 40 million is being responsibly set forward, and it's going to meet your needs currently as passed by the legislature. In order to do this as a matter of background, and we can do this quickly, we need to reestablish what the requests were from GMH and what actually happened so that we can get this roadmap going forward, so we can show the folks here that we have a plan. I know this is sometimes a funny expression, but we're from the government and we're here to help. But I need to go straight away, Yuka, to your request for fiscal year 2026 in terms of when you met with OFB. Lay out your general fund requests as well as your capital improvement requests.
I have it. So our requests from the general fund, the additional requests, so this was considering what was in the governor's executive budget request. So the additional request we were asking for the general fund was 21.9 million, and for capital improvement was 29.3 million.
Okay, so give us a total in terms of general fund request and request for CIPs.
General fund request is 80 million. CIPs is 29.3.
Okay, so right now, as passed by the Guam legislature, in our budget that we passed and sent to the governor that was vetoed, do you concur that we have appropriated $57 million in general fund revenue?
Yes.
Do you concur that in that budget there is $20 million recognized in the first excess revenue of fiscal year 2026?
Yes.
Okay, so just in those appropriations alone, that's $77 million. Okay, now the reason why I'm going down this road is because for educational purposes, for those who don't have to bother with the budget, which I'm glad you don't, because it's a tough thing to do. When we start a new fiscal year, we start a clean slate. Basically, you have revenue going forward. That is a new fiscal year, so you can expend that revenue in that fiscal year. Since we passed the 40 million, how much of that is set aside for CIPs?
10 million.
Okay, so now we can subtract that 10 million as well from your request because it's been satisfied for what you're doing right now going forward. Okay, so now we're back down to that 70 million request, right? If we took the 10 million away. So we're on point right now just for with those two appropriations, correct? If the 20 million is realized and the 40 million that we passed took care of your CIPs going forward, we are on track then with what your budget request was for fiscal year 2026.
Are we including the 35 million?
No, we're not. I didn't even touch that. I said the 20 million of excess revenue straight away that's been appropriated in 2026.
I'm still showing 21 million shortage.
Well, you're going to have to reconcile with how you put forward the your CIPs, because your CIPs were clearly the $29 million.
Yes, I agree with that. Yes.
Okay. So what I want to establish here, and the reason why I asked this line of questioning, because I need to go to Ed Byrne now on DOA, and then I'm going to go to Zaldi, and I think we can clean this all up. Ed, now we've made it clear that the 2025 booked revenues of $40 million is going to be expended, and that will help with their CIPs as well. if they, in the beginning of the fiscal year, when you establish your allotment release schedule, if they are able to accelerate the costs associated with the panel, will you be able to negotiate with them to do an allotment release advance to take care of that emergency?
We would certainly look at it very, very carefully because, like everybody else, we recognize the urgency of these requests and expenditure. So we would certainly, as the budget bill, which is currently under veto, says that it is the first priority revenues of the excess revenues. So I'm hoping that we do realize those express revenues, but we're always open, like we have been, to discussing with GMH their needs. And we do, like I've described already, we do react very quickly to help them. We also strive to prioritize their Medicaid payments as quickly as we can because we recognize their need.
So I want the team to understand here that when the CIPs were requested, they were requested for an entire fiscal year. They were put in for the entire fiscal year of 2026. That is why I'm asking this line of question, because the schedule for all of these projects going forward was contemplated in 2026. We're here to tell you it's going to happen. The money is there. It's going to happen. So the last point that I want to make, because Zaldi, I think everyone behind you and all of us and the patients that are currently here receiving excellent care from your staff, we need to walk out of here knowing, first and foremost, with the money available and the quick fix. You said 3 to 6 months so that everybody understands what we're talking about here. Will that quick fix happen now that the appropriation is there? Can you accelerate that quick fix? And will that quick fix stabilize the hospital as we realize the additional funding for the redundant panel to be installed, the brand new panel, so that the hospital can finally have a backup plan, a main panel, and a backup panel?
We will do our best. Whatever comes our way, if there's any difficulties, we'll let you know.
Zaldi, I'm here to tell you, and every senator is here to tell you, once and for all, you don't have a finance problem. You have an execution problem. Okay? There is money to do this. There has been money to do this. You have just told everyone behind you here that to the best of your ability to execute this, we could deposit $40 million just in the account for the panel right now. You have told me off the record, Zaldi, that the new panel construction to provide the redundancy for this hospital is going to take up to a year. Can you put that on the record again?
Like I said, a year is very aggressive.
A year is aggressive. For a brand new panel to provide the redundancy needed for the Guam Memorial Hospital to have its current panel, and for those of you, I'm asking right now after this is done for a field trip down to the panel, and I hope we will be accommodated. For those of you that are here so that you completely understand this, as represented in the past by hospital administrators as well as the maintenance folks, the reason why the redundancy for the panel and the construction of the new panel as well is not only for a redundant system, so you have 2 panels, you have backup, is because your current panel is co-located with a water tank. And if that water tank for some reason should rupture and not contain the water that it has in it, it will not be because the breakers are old and some of them need to be repaired. It will not be because the fact that downstream from the panel there's been additional load that's been put on it. It will be because water and electricity do not mix. That will take the panel out in one-shot deal. That's the reality. And the reality is, I know this legislature will finish this term with full funding for this panel redundancy and the repairs that are currently needed for the current one you have. But what we're not going to be able to be responsible for is the fact that the procurement, the timeline for 1 year being aggressive for a new panel is beyond our control. We would hope if there's a way to come forward and say, a miracle has happened and we've got a contractor that says they can do it in 90 days, the money will be there. We'll take it from everywhere we have to and we'll make it there. Until we're notified of that, we're going to leave here today. You're going to leave here today knowing that we're going to move everything, heaven and earth possible, to make sure not only that top priority of the panel, but all the other CIPs that have been requested in the budget are going to be fully funded from the general fund. Thank you, Madam Chair.
Thank you, Senator Duenas. I did have a couple of questions that I wanted to ask. Trustee Mel Manjola, is she here? Melanie Manjola? She's not here. She's here? If you could come to the table, because I did have some questions, and I think that the public, if they didn't get a chance to watch the Board of Trustees meeting last night, she's one of the newly sworn-in Board of Trustee members, and there were some resolutions that she had presented to the board. It wasn't acted upon yet. It's still in its draft form, but I think it would be beneficial for our committee and our senators and my colleagues to hear about one particular resolution, because as we continue to talk about the finances of the Guam Memorial Hospital, this resolution, at least it demonstrates some of the things that you would like to see implemented in GMH, and it's the right sizing GMH resolution. If you could kind of break that down for the committee.
Hafide, thank you, Madam Chair. So there were two resolutions. The first was a medical supplies reserve account, and
I'm sorry, if we could swear you in.
Sure.
Please raise your right hand. Under penalty of perjury, do you affirm that any and all information you provide today, whether it be verbally, electronically, and in writing, be the truth, the whole truth, and nothing but the truth?
I do.
Thank you, Madam. Madam Chair, she's under oath. You may proceed.
Hafide, my name is Mel Mendiola. It's nice to see all of you good senators here today at the Guam Memorial Hospital. I'm a relatively new member of the Guam Memorial Hospital Board of Trustees. I'm also the former administrator of GIDA, so no stranger to this this group right here. So the Board of Trustees, the way I see it is that the Board of Trustees is to look in for the governance of the organization from a strategic point of view. And so to take what we're hearing, to take what we know, use our knowledge and our backgrounds to then set policy, set direction for the organization. Because of my background at the Guam Economic Development Authority, I'm fairly familiar with how a government agency works, and usually the revenue generated for government agencies, I think it's no secret, you can either generate your own, which our autonomous agencies do, or you can go to the general fund and ask for and get an appropriation via the budget process. You have agencies like GPA, GWA that are fully funded, fully autonomous, and then you have agencies that are sort of line agencies where they receive 100% of their budget. At the Guam Memorial Hospital, you have a hybrid of a situation where you get, it generates, the hospital system generates approximately, over $100 million, and then the legislature comes in to help close that gap of the cost to administer the services. As a hospital serving a relatively small population, the Guam Memorial Hospital is challenged with regard to fixed costs. So, for example, departments like your finance department, your HR department, the hospital system. If you were looking at a hospital, let's say the Queens Hospital System and health system in Hawaii, 10,000 employees in the Queens Health System. Their HR relative to our HR will be bigger, but not that much bigger, because you spread out more employees. More employees are covered and supported by support staff. So far, following me so far, great. All right. So what I looked at was over the years, I looked at the budgets, I looked at the audits, going back pre-COVID, post-COVID, and so on and so forth. And one thing I noticed was that the legislature tended to have the propensity to appropriate anywhere from 30 to 50 million, 30 to 50 million. And there are exceptional years, and I would certainly say that this is one of them where there are exceptional CIPs that are needed, but 30 to 50 million for the purpose of operational. That means ongoing payroll, management, medical supplies, and so on and so forth. That is aside from and independent of CIP. And so when I started to pull out those numbers, I said, you know, I think that if we always know if we're collecting 133, but we kind of hit the top end at 50 million, that's 180, and we're submitting a 210, 220 budget request, that leaves us with a gap of about 40 million. So then the wheels started to turn, of course, and there's primarily two ways to do that. You can increase your revenue or you can decrease your expenses, right? So we looked at revenue, and we have some ideas that I've spoken to our interim CEO as well as Ms. Lil about. Revenue expansion does, of course, take time. Some of the more immediate things that you can do, though, is you can look at your current staffing pattern and determine if your staffing is appropriate relative to the services that are provided. So I'm currently the chair of the Finance and Audit Committee. So the process of the Board of Trustees is the Board of Trustees shall go and meet in committee where we will receive feedback on this resolution. So we drafted the resolution. I received the feedback of the different managers in the different departments. Some of the feedback I received was, hey, you know, we're already sure there is a nursing shortage nationwide, and you're contemplating laying off nurses? That's crazy. I said, yeah, you're right, that is crazy. So after the first round of kind of discussion and talks, we went back to the drawing board. I started to look at old audits. I went back to 2018, 2019. I looked at those audits. I saw that from the clinical point of view, clinical was spending the level of payroll spending for clinical was relatively level, meaning nursing, hospital, and professional services. So I think these are like your respiratory, your physical therapists, things along those lines. So your clinical position, the clinical buckets were all pretty steady from 2018. There wasn't an overabundance of hiring, and if you think about it, there have been a number of pay adjustments. So what we're really talking about is there are fewer people doing more 6 years later on the clinical side. The admin side, the admin, fiscal, and so the non-clinical side, that doesn't tell as clear of a story to me. And so what I said was, hey, why don't we aim for a 10% reduction in total payroll? That works out to about $10 million. That $10 million shall be split proportionately among the different departments, excluding clinical positions. But clinical positions are also, what we're looking at are two areas: overtime, and seeing if we can reduce overtime, to which I was very, very happy and very proud of our managers who came forth and said, I think we can actually reduce overtime by about 30 to 40% for the next fiscal year. I like that. So there's the payroll for non-clinical positions that we could look at. We could look at budgeted vacant positions, see what's truly critical versus what's not critical. We could look at limited term appointments, who's expiring, and there's also the natural attrition of a hospital system. From the board perspective, we're setting a policy that says in the resolution the board resolution had it passed last night, set 90 days for a plan to be developed and presented to the board for consideration. But we tabled it till next month for a little bit more work, a little bit more improvement. Some of the more granular things that came out as a result of the meeting was you had one trustee who said, well, what about if we do a 32-hour work? We've got another trustee that said, what if we do this? What if we do that? But the thing is, that's not the Board of Trustees' job. Our job is to set the policy and then for the managers to management to then carry it out. So it is my hope that in the 90 days or the 60 days or the 90 days that management will come back to us with the feedback of, and you know, and I've heard it all. I heard, you don't know what you're talking about. And I said, you're right. I don't know what I'm talking about when it comes to, I don't know how many nurses are needed in an OR. But I can tell you, I know a little bit about running a government agency, a solvent one. And so the back and forth is important because these managers, they're supposed to be their biggest, they are the biggest advocate. They are their biggest advocate for the people that are behind me, which are the staff and of the Guam Memorial Hospital. So for them to come and, so I was actually very pleased because if I said, hey, you guys got to cut 10 million payroll, and then if they're all like, that's cool, then that would have been really alarming to me because it would have showed that everyone was on board, that there was so much, there's just that much dead weight. You guys can cut 10 million without an issue. But I said, let's cut 10 million. And, you know, these were like fighting words. And that to me was very encouraging because it shows that there has been significant thought as to what every position does and what every position contributes, right? And I mean, the nurses, they really did scare me. That's why I took completely 0 cuts there. Other departments were a little bit taking a little harder line. But to me, that's it's to me again. What I shared with in the committee meeting, and I'll share it with you today, is I shared with our executives. I said, listen, it's good to hear it from your trustee because if you hear it from your trustee, you can fight back and you can do all the things, and then you can eventually come to a compromise. But if we don't follow this, if we don't take on an exercise like this, you know, and try to come up with a good result, then you know where it goes? It goes to the legislature to legislate a RIF. It goes to a receiver, and you know what? None of you will be in this room because the receiver will fire you all first. And so, to me, these are all the steps that need to be taken. That was really the ultimate point of that particular resolution, was to create an environment where we are not going to rest until, to me, if we can cut 10 million from expenses, if we can increase revenue 10 to 15 million, and I think there's a number of ways to do that, then we keep on closing that gap. Rural hospital, or not, I'm sorry, rural hospitals, similar sized hospitals in America that are receiving, many of them are receiving government appropriations. But is that government appropriation, you know, that government appropriation is oftentimes 20% of their budget, not 80% of their budget, not 50% of their budget. It's 20%, right? So if you're giving the hospital $80 million, then quite frankly, we should be running a $500 million operation, which we're not. So these are the things that in my mind, I recognize that there are unique things about Guam. I recognize that it's more difficult to carry out services in a remote island with a small population. I recognize all those things. But at the end of the day, we are not a super special snowflake. We are a hospital, a community one, right? So that's pretty much it.
Thank you, Melanie. And I look forward to continuing to watch the progress of this resolution as well as the other one in the work that that the trustees is doing. But also just want to thank all of the employees that are here and watching, and everybody that's watching online. Thank you to the panel. Mr. Byrne, thank you for answering the questions. And that concludes today's joint oversight hearing. Again, thank you to GMH for welcoming us. The time is now 11:33. We are officially adjourned. Si Diyos Masi.